Good morning, everyone. Today is February 1st, and it's 8:30, so I'll call our meeting of the morning to order, please. Looking for an approval of the agenda.
So move.
I have a motion
Second.
by Commissioner Gross and a second by Commissioner Ebinger to approve the agenda. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign, carries. Our next item is our employee recognition. Okay, can you hear me? So today we have a long list of dedicated social workers that have been with the county for a great amount of time. Our first longevity award for the morning, it goes to Juan Becerra for 20 years of dedicated service to Clay County and its citizens in the Support Enforcement Aid Department. Sandy, do you want to say something?
Sure. He was having car trouble today, so he didn't make it. He actually goes by Manuel. But he is just one of those really steady guys that you can count on. And I always say every time I come here, I have an awesome group of people that I get to work with. And he's one of them. We're really, really fortunate to have him.
You can clap. All right, the next person today that we'll be honoring is Desira Oline for 20 years of service to Clay County and its citizens. All right, thank you so much. I'll give you a fist bump here.
So Desira is one of our LADCs in the Behavioral Health Unit. She went back to school a couple of years ago and obtained her license so she could complete our comprehensive assessments. She's been an integral part of our CD unit moving forward with the changes that the state has implemented in the service delivery for individuals that serve substance use disorders. Desiree and I have worked together a very long time, and just some of the things that I appreciate about Des is she's a hard worker, she's dedicated, she is passionate about the individuals that we serve, and I always tell her every year at her annual review that I appreciate her honesty and the humor that she brings to our unit. We need that some days more than others. So I appreciate everything that Desiree does in our unit.
Okay, Sheila. Sheila, this plaque is given to you today in grateful recognition for the 20 years of service to Clay County and its citizens. Thank you so much for all that you do. And Jessica, do you want to say something?
Sure. Well, Sheila's been with us for 20 years, and she's
So if I give this to you, this means you have to stay for another 30? Is that how that works? Rhonda, this plaque is given to you today, and hugely grateful for your 30 years of service to Clay County and our citizens. Wow, you've just done an amazing job. We're so appreciative of what you do. Steve, I think is going to stay over there, but he's got something.
Yeah, congratulations, Rhonda. I want to thank you. I've been fortunate enough to work with Rhonda for my entire career in various positions. I think when we look at Rhonda really exemplifies what it means to be a Clay County employee and also a department head. She's an excellent leader. She's dedicated. She's strategic and problem solver, both within her department and with the challenges that they face in providing the service. Ensuring that we have the high quality service is something that I know that she focuses on and is something that's been extremely important. She has one of the largest budgets or the largest budget here at Clay County, and from a fiscal responsible standpoint, she stretches that dollar to ensure the needs of our clients are met, and also is responsible to our taxpayers. And so she did turn down the next 30-year contract, but we're hoping that we're so happy to have her as an employee here at Clay County. So thank you.
I think as a follow-up, it probably is a testament to your leadership to have all of the longevity awards today within your department. So thank you. Our next item for the morning is a citizens to be heard. Are there anyone here wishing to speak to the board on anything that's not on the agenda? Steve, had you received any response?
We have not, Madam Chair.
Okay. Moving into the approval of minutes from January 18th that are presented, I did have one correction that I'd talked to Steve earlier about. In my committee reports, the conversation that I'd had with Red River Communications was not about a disconnect. It was about applying for a USDA grant and support for that. Steve will make the adjustment. And then also, I think it's important to add that Eric Dodds is from AE2S.
Move approval with corrections.
Motion by Commissioner Campbell to approve with corrections. And a second by Commissioner Kaylee. Any further discussion? All those in favor of the motion signify by saying aye.
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 Opposed, same sign. Carried. The bills and vouchers.
Move to approve.
A motion by Commissioner Gross to approve
Second.
and a second by Commissioner Ebbinger. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. Item 2 is our COVID-19 weekly update from Public Health. We do have Becky with us on Teams. There she is. Make sure that
Good morning, Commissioners. Can you hear me okay?
we can. I just want to get a nod that the microphone is picking it up correctly. Is that broadcasting, Steve?
We should be good, Madam Chair.
Okay, we are good, Becky.
Great. And then Steve, if you're able to pull up the PowerPoint.
Should be.
We were seeing it. I think he just needs to share the screen. He's working on it.
Okay. Technology is great.
Can you see it, Becky?
I cannot, no.
Okay, it is up, so we can see the weekly reported cases. I think Steve's gonna work on trying to screen share that, but if you wanna just give verbal cues to change the page, he can do that, so we can start.
Sure, let me just pull it up on my end so I know what we're looking at. Okay, so the first slide here is our weekly reported cases. And again, this is reported by date of sample collection, so the date that the person was was tested. And really at this point in the pandemic, we spoke about this last week too, but this is the most accurate way for us to report our cases now for a couple different reasons. One being that there's so much lag in reporting, and the other being that there's such a variation too in the amount of time that people are in isolation. So some people, you know, they're in isolation for 5 days, other people it's 10 days. So this is really our most accurate way right now. So you can see for Clay County, for the week of the 16th to the 22nd, we had a little over 1,000 new cases. Of note, last week at the board meeting, we had reported 394, so it's more than doubled, almost tripled that number as the reports or the data has caught up. And then for last week, the week of the 23rd, there were 597 new cases reported. Again, that is a preliminary number, and we expect that number to go up. Statewide for Minnesota, the week before last, there was over 62,000 new cases, and last week we had reported 8,900. So a huge jump in the numbers as the numbers catch up. And then as a preliminary number for last week for the state of Minnesota, we had 17,111 new cases. For Cass County and North Dakota, it does look like cases have maybe are starting to trend downwards. So we're hopeful that maybe we're over the peak and you know, we'll start to see cases go down. Then you can go to the next slide.
All right.
And then this is the reinfection data. So again, you know, we anticipate these numbers to go up every week. So for Clay County, we've had 687 reinfections statewide, 47,710. And then for the state of North Dakota, 9,800. And again, a reinfection is defined as someone who's tested positive with COVID and then winds up getting reinfected, you know, 90 days later, or at least 90 days later. And next slide.
Okay.
And this is our Clay County cases reported per week, just going back to August 1st of last year. So you can see we had a really huge spike of cases starting beginning of January. Again, hopeful that maybe the week of January 9th, where we had over 1,400 cases, that was the peak of this Omicron wave. But again, time will tell if that trend continues. A little over 1,000 cases reported the week before last. And then again, 597 for our preliminary number last week. And that's why that bar is shaded gray. Next slide. This is our epi curve throughout the entire pandemic. So starting out with our first case back in March 15th of 2020, going all the way through last week. So you can really see the defined spikes of cases that we've had, and then really just that huge increase of cases in January. Next slide. This is Clay County cumulative cases broken down by age. So we've had a total of 17,574 cases reported in Clay County. And again, that age group of 20 to 24 is where we've seen the most amount of cases reported. Right. All right, and this is the CDC level of community transmission. I think it probably goes without saying that we're still in a high level of transmission in Clay County and throughout the whole state of Minnesota. Next slide. This is Clay County deaths per week. We did unfortunately have another death reported. So we've had a total of 116 Clay County residents that have died due to COVID throughout the pandemic. Slide. Should just ask, is everyone still able to hear me? Okay, I can't see the presentation,
Yeah.
so I'm.
No,
Okay.
You're doing a great job. We are now on the Clay County Hospital admissions per week slide as well.
Perfect. Just didn't want to get too far ahead if we were not on the same page.
Oh, we're good. Thank
So
you.
this is the Clay County hospital admissions per week. As you can see, we saw a pretty large increase in the number of admissions the week before last. at 31 admissions, and then so far for last week, 21 admissions. So, you know, concerning and something that we're definitely keeping an eye on, but also expected. So, you know, typically anytime we see a large increase of cases over the next 2 to 3 weeks, we'll see an increase in admissions. This is the hospital capacity information for our healthcare systems in Fargo. So at the time of this report, there was 8 available staffed ICU beds, and 1 staffed pediatric ICU bed available at Sanford in Fargo. Statewide totals available adult ICU beds were at 15, and available pediatric ICU beds were 2. Next slide. This is COVID hospitalizations in North Dakota. So a total of 184 currently hospitalized. That is up a little bit from last week. I think it was 164 last week, but the number in the ICU has remained the same. Currently, there are 2 pediatric patients hospitalized, North Dakota residents that are pediatrics that are hospitalized. And then the graph on the right, again, is just the cumulative hospitalized broken down by age. This is the vaccine breakthrough reports that MDH puts out weekly. So you can see side-by-side comparison of last week, our cumulative percentages compared to the most current data that we have on the right-hand side. So as you know, anticipated, the breakthrough cases are going up a little bit, so 8.388%. Breakthrough hospitalizations and deaths really are not moving, which is what we're looking for. So those remain low. Again, main message here is that these vaccines are working incredibly well, preventing serious illness in people. Next slide. This is the charts that I showed last week that MDH puts out. Really just a fantastic visual at the difference in COVID deaths that we're seeing in Minnesota. So the blue line is those that are not fully vaccinated. The green line, which you're not really seeing moving much, is the people that are fully vaccinated. So the majority of deaths that we're seeing are in those that are not vaccinated. This is just kind of an informative slide that I included this week because we get a lot of questions about variant distribution in Minnesota. And so as you can see, Delta really was the predominant variant starting last summer in June, and saw that huge wave of Delta cases up until recently. And then Omicron very quickly took over as the predominant variant. So for the first 2 weeks in January, 90% of COVID samples that were sequenced were the Omicron variant, and still seeing about 10% of those sequenced are Delta. So seeing both variants circulating, but Omicron by far is the most prevalent.
Becky, can we take a pause really quick? I think there might be some. First of all, thank you for including that. That is, as you stated, an excellent diagram. Commissioner Cayley.
Yeah, Becky, there's a blue line that runs through the middle of that chart. What's the blue line supposed to signify?
You know, I'm actually not sure. I think it's a trend line, you know, for number of reported cases. So it should kind of line up with the waves that we saw. But I would have to double check to see about that.
Thanks.
Any other questions on that? You can continue. Thank you.
So the next slide is our statewide vaccine data updated as of the 27th January. And this includes those that are ages 5+. So people with completed or people that are fully vaccinated statewide, the percentage is at 69%. Again, our vaccine data is for Clay County is likely underreported, but from what we do have, we're showing a little over 60% of those over the age of 5 are fully vaccinated. So we are running a little lower than the statewide percentages. And then we've had a little over 2 million people that have gotten their 3rd dose or their booster. This is the amount of COVID vaccine doses given out by Clay County Public Health per week. So we've done 19,104 doses to date. continuing to kind of see a decrease in the number of doses that we're giving out per week. So last week we had just 45 doses that we gave. Right. So this is breaking down those 45 doses into what they were for last week. So we had 2 first doses, 3 second doses, and then 30 third doses or boosters. Pediatric vaccines, we just gave out 1 first dose and 9 second doses. Next slide. And then in terms of our vaccine clinics for this week, we do have 2 tomorrow at the Family Service Center. So tomorrow, Wednesday the 2nd. Our first one is 11 to 1, and that's a clinic for those ages 12 plus. So Pfizer first, second, and booster or third doses are available for those 12 plus, and then also offering Moderna first, second, and booster doses for those ages 18 plus. And then having a later clinic in the day for the pediatric doses, so ages 5 plus, giving Pfizer first and second doses for 5 to 11-year-olds, and then continuing with the Pfizer first, second, and booster doses for ages 12 plus. And again, if anyone ever has any questions about coming in for a flu shot or COVID shots or really any other vaccines, you can give us a call, and that's our vaccine hotline there at the bottom. And lastly, I just wanted to, I like graphs, so I put the weekly positivity rates for our vault test site into a graph just to make it maybe a little easier to see. So we don't have the numbers for last week yet, unfortunately, but you can see from the week of the 16th, really a very high positivity rate at, I think it was 27%. So that's a really good indicator for us to know what's going on in the community. You know, as we start seeing the positivity rates go down, we can be fairly confident that we've peaked and that trend will stay. So we'll just see, you know, as the data comes in for last week, where we're at with that. And then total tests administered at the Moorhead site is 98,639. Great.
Thank you so much, Becky.
Any questions?
Any questions on this piece? Commissioner Kaylee has a question.
Yeah, Becky, back on the first page of the weekly reported cases, you had 597 for our preliminary number for Clay County. And the last 3 weeks, that number has more than doubled as the data has caught up. Do you feel like we're still in that trend with the data lag, that it'll probably double, maybe more than double again?
You know, it's really hard to say. When we had our meeting last week with the Minnesota Department of Health, they are slowly getting caught up, you know, with this data lag. So it's really difficult for me to give you a for sure answer. You know, I anticipate that number to go up as it always does. Whether we're going to continue to see this trend of it doubling or almost tripling every week, I hope not. But I will plan on, and I did this last week too, later in the week, so on Thursday or Friday, running another report and then updating the numbers that I did, you know, at the beginning of the week. So hopefully that can help give a clearer picture later on, you know, after the numbers have had a little bit of a chance to catch up.
Thanks, Becky. That was really helpful on Thursday to get some more perspective on that.
Yeah, you bet.
Commissioner Kaylee, thank you. Commissioner Campbell.
I just wanted to point out that on the Clay County cases per week graph that is just behind what Commissioner Kaylee just asked about, there seems to be some positive news in final numbers between January 9th and January 16th. Those numbers are final, and they went from 1,465 to 1,025, so that is encouraging. You know, so hopefully these numbers are correct in that 597. We are catching up, and it would sure be nice to see that somewhere under 1,000 anyway, to see we're going in the right direction. Just to point that out, that we basically 1/3 less from the 16th, from the 9th to the 16th. They're still big numbers, but they're hopefully that peak has happened in Clay County. So.
Can I just ask a clarifying
Kaylee.
question? Commissioner Campbell just said that's a final number. I didn't pull my chart out from last week, but I kind of thought that where it now says 1465, that was 1390 last week. So maybe there is like a few more that trickle in a couple weeks late. Is that accurate, Becky?
Yeah, we are seeing that more so now than before. Usually there'd be, you know, when you would go back maybe 2 weeks, you would see a little bit of a trickle upwards, and now that has been stretched back a little farther. So, you know, again, I hope that as numbers go back down, we don't see that lag. But yeah, you really shouldn't see too much variations, you know, 2 weeks previous.
Anything else? Becky, in regards to, I'm maybe skipping ahead a little bit, but talking about the positivity and having had significant conversations with the governor's office and MDH regarding that Volt site and testing. You know, I know that the rapid test is a great one to have, but really it's not the gold standard like the saliva. And are you seeing, sorry if there's feedback, are you seeing people go in for the rapid, maybe getting a positive, and then going over to submit the saliva test in the same session?
You know, I guess I can't speak to that for the most recent weeks. That would be typical to what we had been seeing, you know, beforehand, where people will get results on the rapid test and then want to go out and confirm it with a PCR or saliva. You know, I think we're trying to steer people away from that, particularly if you test positive on the rapid and you're having symptoms. We really want you to go with that positive test. You know, just there's not enough testing to go around as is. So once you get a positive, there really is no reason to confirm that. Does that answer your question? Did I understand correctly?
You did, and I think for those of us that are trying to read the data weekly, it's hard if we, obviously the strains are much more prevalent right now. We all know that, but in terms of what these numbers are, it would be nice to know what the unduplicated number is. And I don't think that's a number we even can grasp, but I think it's important that we also maybe are aware that that's happening. Do you want to move into the Vault information? Do you have that, Becky?
The handout?
Yes.
I don't have that handy right now.
That's okay. I can maybe walk through it if, I know the entire board has it, but I think for the public. During the last given information that we have would be that week of the 16th, January 16th. So the number of tests that week conducted total were 2,796. The positive results, 769 of those were positive, moving that positivity rate to 27.5. I think that it is helpful to see that from the beginning of January, we're upwards of more than 1,000 more than where we started at the beginning of January. I think there's probably still substantial need out there for availability for testing. And then the information that we have in terms of the saliva and the rapid haven't been updated, so that's the same as what we've had in weeks prior, but anything else? Maybe now's an appropriate time, Steve, to talk a little bit about the response from Minnesota Department of Health to our letter for Vault.
Thank you, Madam Chair. As the board recalls, here a couple of weeks ago, this board approved a letter to go along with the City of Moorhead officials to the governor's office, Commissioner Jan Malcolm, and also our representatives. Commissioner Mojo and Mayor Carlson, along with Kathy McKay, had some ongoing conversations with the governor's office and MDH office. I think the response that we received probably didn't meet the expectations of what we were hoping for. The response, they did provide some responses, which I think were to coordinate some of home testing that has becoming available, continue to utilize Cass County's facility, which we know is not something that currently Cass Public Health is wanting us to utilize. We, as part of the discussion, it was shared that the executive of Vault was going to be coming to Moorhead to see how things were being done firsthand. It's our understanding that the person did come to town, but unfortunately did not coordinate with any of our officials here within the city and county, and so that was disappointing. Kathy McKay had requested a meeting with the state officials and also the Vault executive, and at this point that meeting has not taken place.
Thank you. As a follow-up to that piece, Representative Heather Keeler and I had a meeting on Tuesday evening of last week with the governor's office, but also with Commissioner Malcolm's office, to state the same position, to advocate for flexibility in the hours. If they weren't going to provide more hours, let's provide some early morning options. Their comment was that they're hoping to switch a little bit more from community sites being a mitigation tool to community sites being a testing option for people exhibiting symptoms. And I did receive a follow-up email last night from the governor's office to maybe talk a little bit about what this official that came to town would suggest. So I believe Commissioner or Representative Keeler and I will have a follow-up meeting in the next day or two to advocate for increased collaboration with the locals on the ground. Any further questions? Right. Becky, thank you so much. We appreciate you tuning in.
I did have a couple other quick updates,
Yes.
if that's okay.
Yep.
We did receive a shipment of 10,000 KN95s that we're able to distribute to the public. Our first priority is developing a distribution plan to really get these out to community members that may have barriers to access. So we're currently working on that. But also anyone from the general public is able to stop by our public health clinic on the first floor and pick up some KN95s for use. So I just wanted people to be aware of that. You can certainly call or email with any questions about that as well.
Thank you, Becky. I appreciate that we received that shipment. I would encourage you to coordinate with the social or the senior service centers or the senior centers in Clay County. I know that they serve a population that wouldn't necessarily make it up to Moorhead. I know that Robin Christensen from CAP LP would be a great contact to talk about some vulnerable population. And I think, you know, Rhonda's sitting in here nodding. Our departments work with enough folks that may be isolated that we can connect to get those masks. Any other questions? All right, anything else?
And then, yeah, the other update I had is that Kathy and I met with the CMOs of Sanford and Essentia on Friday. So it was really helpful just to kind of get an update from our local healthcare systems about COVID. You know, they both agreed that their biggest challenge is really having enough staffed beds, which is no surprise to us when we look at our hospital capacity data. And, you know, they're seeing about a third of their current inpatients are COVID positive. And so certainly not, you know, the burden of COVID is very real. It's not the only burden out there, but it is putting a pretty big strain on the hospital systems. They mentioned that many COVID patients have a very long, tough recovery after being discharged from the ICU and can be, you know, hospitalized for weeks and weeks afterwards. And the other thing that they brought up is there's a very, very limited supply of the monoclonal antibody treatment. So with Omicron, there's currently only one drug that is effective against Omicron, and that's in very short supply. Sanford said that they have a wait list of over 100 people waiting to get that. They will be having another treatment, a shipment come in, remdesivir, but it is not as easy, I guess, to give out. So it's given via IV over 3 days. So it's not quite as simple as the the infusion of monoclonal antibodies. So.
Thank you, Becky. Commissioner Kaylee.
Becky, in that conversation with the CMOs, when you share the hospital capacity with us, this is like a moment in time. How did you talk about how that's fluctuating over the week? I mean, I'm sure there are times when they are full or times when they have a little bit more space. Did they talk about that at all?
They did, yeah. I mean, it's really hard to share the hospital capacity because, like you said, it is just a snapshot in time. So it kind of goes up and down, depending on the day. They did say they have not had to implement any crisis standard of care yet, so that is good. They are starting to see the number of staff out as of late last week. Is not as bad as it had been in the previous 2 weeks. So we're hopeful that the capacity will increase over the next week or so.
Thank you, Commissioner Kaylee. Commissioner Campbell.
Becky, can you explain the difference between the monoclonal, what I think is what you called it, versus what I always knew was plasma? Is there a difference in those?
There is. So the monoclonal antibody infusions that we talk about are antibodies that are generated in the lab, so they don't actually come from an infected person, whereas the plasma is taken directly from the blood of a person that has been infected. And to my knowledge, I think it's been shown that the monoclonal antibody treatments have been more effective than plasma.
So if it's created in the lab, why they can't produce that in large quantities then, or why is there such a shortage of that?
I guess I don't have a clear answer for that. Part of the problem is that there were 3 or 4 different monoclonal antibody treatments that worked for Delta and for previous variants, but there's only one currently being made that works against Omicron. So I think that's just added to the supply chain issues. There's just not enough of it to go around, and it takes time to synthesize it.
So one final question, going back to the plasma is still an effective treatment that's used?
I know that it is used still. I'm not sure to what capacity. The last I had heard is that it's maybe not as effective as the monoclonal antibodies have been, but I can look more into that and get you a more direct answer.
I know early on, before the monoclonal was even available, plasma was a critical one, and we had called for people to donate. And I'm just curious if that's still something that should be encouraged. Right, so maybe you can follow up with us on that.
I'll follow up with that.
Thank you.
Thank you. Any further questions? Any further questions? Thank you for your report, Becky.
Yes, you bet. Thank you.
Our third item on the agenda today is a request for the proposal for the 2023 managed care request process and the county role. Rhonda Porter, good morning.
Good morning, Madam Chair, Commissioners. Okay, my first item, yes, is a discussion about managed care procurement. The last time I was before the board on this topic was in 2019. I thought I would just give a little bit of history with this, and then there's a few questions I would have for the board at the end in terms of the current procurement process for 2023. So around 25, 30 years ago, Minnesota was kind of a leader in developing a demonstration project on individuals who apply for Minnesota medical assistance and how we might use prepaid managed care programs to help with the ever-growing costs of healthcare and improve health outcomes. So at that time, the commissioner was authorized to select medical vendors and then contract with those medical vendors on a prepaid capitation rate per enrollee. At that time, this was around 1997, and before my time on this topic anyway, counties were given an option to choose prepaid managed care in their county or develop what's called county-based purchasing. So it started out, many of the counties opted for PMAP, or prepaid managed care program, but there were some counties that developed county-based purchasing in their counties. So with that, DHS, in terms of selecting these managed care organizations, DHS does a competitive request for proposal process, and that's the process by which health plans are then selected. It occurs approximately every 5 years, and at that point, once they're selected for the counties, then the State Department of Human Services enters into contracts with those health organizations. They're one-year contracts and they're renewed annually, generally up to about 5 years. And then the procurement process starts over for those organizations to rebid, so to speak, to continue in counties. So we're at the 2023 managed care process right now, and there's 3 RFPs that were just issued by the State Department of Human Services for the greater 80 Minnesota counties. Those RFPs are to serve families and children under the prepaid medical assistance program, for Minnesota Senior Health Options, Minnesota Senior Care, and what's called Special Needs Basic Care. So they're different eligibility programs for individuals who are applying for Minnesota Medical Assistance or Minnesota Care. So based on age, disability, income, all those, there's various eligibility factors in various programs. So those 3 RFPs have been issued and are awaiting health organization responses to which counties they would like to provide managed care in. Just to give you some numbers, I'm on slide 5, current managed care enrollment for Clay County. So under the PMAP for families and children, we have a little over 13,000 individuals that are in managed care, and they are either on Blue Cross and Blue Shield's Blue Plus plan or Health Partners. In Clay County, the majority of our folks are on Blue Plus. So probably of that 13,000, around 11,000 are on Blue Plus versus Health Partners. We have 566 individuals on MSHO, which is Minnesota Senior Health Options, again, which is for some of our elderly population, as well as Minnesota Senior Care Plus. We have 153 individuals on that program. The health organizations in Clay County are Blue Plus, Medica, and UCare for those 2 programs. And then the last program is SMBC, which is called Special Needs Basic Care. We have a little over 1,000 people on that program, and the providers are Health Partners and UCare. The next, actually 5 slides, is just some maps that give you a glimpse statewide of what programs are in what counties. I won't go over them in detail, but there's the 4 different, actually 5 different areas, because Minnesota Care is on there, and you can just see that it's pretty vast throughout the state, which counties have which plans and which counties have county-based purchasing plans. So those are just for review. Going on to slide 11, back in 2019, when the state was completing the procurement process, you may remember that the process was that DHS would issue the request for proposals. You would have health plans respond to those proposals and say which counties they would like to provide which program in for your county. And the county role at that time was we could submit questions that the state would include in the RFP that would require the responders to respond to. And those questions would target things that we identified in our county or our region that were really important, like provider network, you know, how they serve various populations, how they might handle transportation issues. So responders would respond to those 10 questions, and then those 10 questions would be sent to the counties, and we would assign individuals to review their responses, and we would score their responses based on what's important for our county, what we know of our population. And then we came to the county board and we said to you, we had X responders for our county. These are the 2 proposals that we think would most meet our needs based on the questions and what we know of the providers. And we did a resolution for the providers that we wanted in our county. We sent that to the state, and then months later, we got a notice indicating who they selected for us. And at that time, they selected 2 health plans that were not the ones that we selected. This was an issue across the state, and it created quite a bit of mediation requests. We did then do a resolution to request a mediation so that we could understand why and the health organizations that were selected for us were selected, because a lot of information we weren't privy to. There were some lawsuits across the state, and at that time, the whole process was put on hold, and we kept our current health plans at that time. And now we're to this point. So now we're in a new procurement process. Since 2019, the State Department of Human Services has engaged AMC representatives, MAXA representatives, community partners on this whole process on how we can make it more county involved, how we could be more clear on the decisions that the state is making, and hopefully result in more favorable outcomes in the eyes of the counties in terms of the procurement process. So over the last year, I've been participating in some weekly meetings as a representative for our region. We have another representative as well. But being involved in helping to develop the questions that would be contained in the RFP. So it's become more of a state-county partnership as well as community partnership for understanding what the pain points are, so to speak, of the healthcare coverage. What are some of the issues that we would want to make sure the responders get at in the RFP process? We've solidified those questions. They're contained in the RFP. The RFPs are out now. And so now the county role is we could take a couple options. We could identify reviewers for our county that once the responders submit the RFPs and we know who they are for our area, we could assign staff to score each RFP. If we decide, we could also choose not to submit a score at all and let the state and the other reviewers decide on plans for our county. I've made an assumption that as a county board that my hope and my recommendation would be is that you would support us assigning staff to review the RFPs and to review the responses and the scores and make a recommendation that we think would be best for our county. It's quite a commitment because what the state is trying to do with this new process is maximize inter-rater reliability, increase objectivity, increase the, just the consistency of the process county to county. So they've divided the state up into groups. So we would be along with, I want to say, 3 or maybe 5 other counties. We review the RFPs, we come together as a group along with the state, we compare our scores, we talk about the scoring rubric, and then we make decisions about, based on scores and responses, which health plans would be the recommendation for our counties. And then we would then bring that to the board. The board could decide that they would like to do a resolution then, they'd like to hear what that outcome was and do a resolution and a recommendation to DHS at that time.
Rhonda, just to clarify, this is a presentation. You're not looking for a resolution of change.
No, I'm really just looking for your support that I'm on the right direction, that my assumption that you would like us to participate in the scoring and the whole process is correct. And if you have any feedback for me on the selection of reviewers.
Questions? Rhonda, you certainly understand the needs much better than any of us. And so you've been here long enough to see what works and maybe what doesn't work. And if you're coming to us that says this new approach really does seem to make a difference, make positive changes in terms of how we go forward in it, I will certainly support that. Not sure if there's board feedback elsewhere. Commissioner Ebbinger.
Just for clarification, Rhonda, this new procedure would involve not just scores from the various counties in the area, but the state will also be a participant in this, so there's no disconnect.
Correct. So, for example, and this is to get your head around it, it is, they've put us in a group, I want to say it's 5 other counties, and so the idea is that all 5 of the counties in our group, along with DHS representatives, will score all of the proposals for those 5 counties, even if a proposal is not indicating an interest for Clay County. But they want all 5 to score all the proposals. And then if you've got 5 counties and DHS, everyone has an equal share in the score. So 1/6 of the share. So it isn't 50% DHS, the state, and 20% the counties say in this. So the new process is to allow equal say, equal share, equal review of all of the requests for proposals.
Just as a follow-up, hypothetical worst-case scenario, the group scores a provider higher than any other, but it's not a provider who's shown an interest in Clay County. Is there an option then?
If it's a provider that hasn't shown an interest in Clay County, the group score will be the group score only for the counties that they're interested in serving.
So there'll be an option where you come to us with somebody DHS has buy-in on and they've been scored high.
Yep, but what I would be coming to our board only for the ones for our county and requesting a resolution for our county.
Okay.
Yep.
Thank you.
In terms of the scorers, one of the pieces that they really highlight is obviously selecting scorers that would not have any conflict of interest. So the suggestion is to stay away from and it has to be county staff. We can't ask maybe a community provider to do it. They've asked us to stay away from current case managers or care coordinators that provide service for individuals in those populations. They've asked us to stay away from staff who are directly involved in the contracting with managed care organizations, which it would be my role, and so I wouldn't be a part of the scoring. In years past, so I've connected with Kathy McKay because these programs are public health serves members under these programs as well. So connected with her and we've talked about the appropriate staff that we feel would be appropriate for the scoring, that know enough about Medicaid, Minnesota Care, know enough about the needs of individuals in our communities facing difficult issues that may have been involved in some of these programs in the past but aren't now. And we would like to propose 2 staff, 1 social service staff and 1 public health staff for each RFP. So we'd have, except for the families and children, we're looking for three scorers because that's a pretty big request for proposal. But it would, for each request for proposal, it would be a social service representative and a public health representative.
Okay. Any other comments? So in terms of a consensus, it seems as though you have a consensus?
I'm on the right track.
Commissioner Campbell? Okay, all right, thank you. Rhonda, let's take your second item.
Okay, second item is a piece that I have included in the 2022 budget, and it did get included in the 2022 budget, and this is for our medical assistance long-term care program. If you remember, we have 2 staff, one that was here 42 plus years that retired in October of 2021, and one that has been here 20 years that is retiring at the end of March here. You had approved, in October, you had approved me to replace the retiring staff, which we did do. So the staff that's retiring in March, you approved me to replace her earlier in October. So we've done that.
Okay.
So we've got 4 staff right now working in this long-term care program. The 4th one now will be leaving in March for her retirement. And we, with the growth of this program, we knew we really needed 4 full-time staff managing this program, and that's why I requested that to be included in the 2022 budget. We were using some savings from the retirements from these long-term employees to balance out the budget request. So for 2022, we had only needed to levy an additional $10,570. Of course, that will look different in the 2023 budget, but we're requesting to move forward with that plan.
Okay, board comments. Steve, has this been a pick?
This has been to pick, Madam Chair. We did ask Rhonda to continue to evaluate caseloads before she came forward again with this request in 2022, and as you can see, they're anticipating that continued growth. So, and the pick committee did request to bring it forward based on that additional information.
Any further discussion from those that were on the PIC committee?
No, I don't think there's anything to add, other than this age group that this is dealing with. We've seen this coming for quite some time. We have more people in that age group than ever that are moving into that age group, and so I can see the demand on the services there, and it's a good service to provide those folks.
Yes, thank you, Ms. Chair. This is a very complex program, and losing the longevity of 2 staff, 60 years it's in the learning curve. And this program actually, when we looked at the year-end 2021 number, ended up higher than we even predicted in terms of the cases.
Okay, board wishes.
Move to approve.
Motion to approve the request from Commissioner Gross.
Second, I do have a question.
Second from Commissioner Ebinger with a follow-up.
Would there be an overfill need on this?
I would request that. That's quite possible that we would have an internal interest and then want to backfill.
Commissioner Gross, would a backfill option be available?
All work fine.
Okay, yes.
We do have a motion and a second from the board to approve the request with a backfill option. Are there any further discussion?
can I-
Commissioner Campbell.
Just to clarification, so is this bringing the total to 4 or is this bringing it to 5?
It brings it total to 4.
And that was basically approved already.
It was, yeah. We, back before 2019, we only had the 2.
Right.
And then we added a 3rd, and this is the 4th. So we knew we needed to get there, yep.
Any further questions, comments? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Granted, thank you.
Thank you, Madam Chair, Commissioners.
Item number 5 is a request for approval for the placement of the Clay County wage grid for our interim jail administrator Kari. Sheriff Empting, good morning.
Good morning, Madam Chair, Commissioners. Thanks for having me this morning. I am here to request we move our interim jail administrator to grade 24, step 1 on the Clay County salary grid. She is currently at grade 20, step 5. Also with this, we'd ask that it is retroactive to January 22nd of 2022. This was brought to PIC and discussed at that time on January 25th, and the consensus was to bring it forward to the board today.
Thank you. As the sheriff stated, this has gone through PIC. We do, we're grateful for Kari being willing to serve in that capacity. I think it's important that we retroactively make that to the first day that she was acting in that capacity. Any further questions?
I'd move the request.
We have a motion by Commissioner Campbell to approve the request
Second.
and a second by Commissioner Emminger. Further discussion. All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. Thank you.
Thank you.
Appreciate it. Item number 6 is a presentation on the Cass Clay Community Land Trust. Trenton? Good morning.
Thank you for this opportunity to come and speak with you today about the land trust and what we're doing, and give you a brief update and answer any questions you might have about our progress and our plan here for this year. For those of you that may not know much about the land trust, to put it real simply, we invest, whether that's time or dollars, into a home to help write down the purchase price to make it more affordable for an average or an area median income household to be able to purchase a home. We were founded back, we became our own 501c3 nonprofit back in 2018. I was hired as their first executive director in May of 2020 and have been serving in that capacity. Happy to report that we brought on our second employee in November of last year, so in 2021, or October, excuse me. So that's been a great addition to our team to help us grow. Specifically, as it looks into Clay County and some of the work we're doing there, we were awarded a grant from Minnesota Housing last year for $200,000 for gap assistance that we are utilizing fully this year through a couple of projects I'll mention. And we were also awarded another $200,000 for some rehab and acquisition, which has really prompted, I think, my presentation here today is really looking to find ways that we can help use those dollars throughout Clay County. Currently, we're partnering with Habitat for Humanity on 2 projects, one in South Moorhead and one in Dilworth, that will be closing here in the next 30 to 90 days, depending on a few things. We're also working with a builder to develop 2 more affordable homes, owner-occupied homes in South Moorhead this year. And then we're trying to find a few more properties to work with. We have another lead on one in Dilworth that was destroyed by fire, that we have been talking with the city over there to see if there might be a way for us to acquire that property, remove the home, and then start building a new home there as well. So those are a couple of projects we have. We do have a couple things in limbo. We are also looking, there's some homes that are coming for sale in some areas that we're looking at if home ownership would be a good thing for the neighborhoods to help stabilize those. So we are looking at that. We've also been working with the city of Moorhead as well on a few projects. Specifically, Maple Court is one project that we've been looking at. Is there a possibility to turn a few of those, as we transition a few of those homes that are affordable rentals into affordable home ownership? Is there a place for us as it relates to the city to then help them reduce some resources or reallocate resources to us? That way we can help manage all those properties and maintain the long-term affordability. One thing you may not know about the land trust that we're also very interested in is not just putting people into homes. We're also very interested in our stewardship program, where we help to teach our first-time home buyers how to become responsible homeowners. Being a responsible homeowner is more than just making your payment, your mortgage payment on the first of the month. It's making sure you're maintaining your yard and you're maintaining the home and you're doing all those types of activities. So we set up budgets with all of our families. We provide how-to courses, simple maintenance, tips and tricks, some of those things. We work with them on any upgrades that they'd like to make to their house to make sure that it's worth their time and dollars as well. We also work with them to get connected into the community, whether that's finding a doctor, becoming active in their school, or just becoming active in the community. We originally got our start as a workforce program, and it is our belief that if we can get our families into home ownership, get them connected into the community, it's that much tougher to leave. I know for myself, once my kids started school, it's really hard to leave until they get done with school, and so we're underneath that premise as well. I will apologize, I don't have the actual Clay County numbers yet. I've been working to get them, but I'm guessing this trend's gonna stick pretty close. I do have some stats here for Moorhead and just what home sales look like, just existing homes that were on the market. I can tell you that the average price increased by $14,000 for a home in Moorhead. Although we did sell 12 more homes in Moorhead, 40 of them were less than $240,000. So they actually saw a decrease in the lower end market of those homes. And even last week, we were talking about it at the Moorhead Business Association. There's currently 44 homes for sale in Clay County currently right now. And so law of averages would tell you that they're not at that $240,000 or less. For us personally, to ensure the long-term affordability, we're trying to get our purchase prices down to about $180,000 to $200,000 right now. Because our area median income for a household of 4 at 80% is just over $73,000, and at 60% it's $54,780. So for us to get to that affordability of about $180,000 to $200,000, in addition to the low interest rates, will help us to maintain a long-term affordability for the homes that we invest in. Kind of a fire hose, I understand that, and so I will entertain any questions you might have as well.
Okay, thank you, Trenton. Any questions from the board? Thank you very much. I know I serve on several different boards with some of your board of directors and know that this is really a mission that comes from a really great place. It's been exciting to see how it's really launched over the past couple of years in terms of awareness, but also the work that you're doing. Any other comments? Anybody else? All right. Well, thank you for the information today, Trenton, and the handouts. Certainly we'll reach out with any questions, but
If you have any questions, please let me know.
Thank you.
thank you very much. Item number 7 is, there are 2 issues from planning and zoning. Erica, do you want to? I think we can also say that our director is out celebrating being a new parent, so congratulations to them on a healthy child.
Good morning, Commissioners. I'm Erica Frank. I'm the Planning and Zoning Technician, for those of you that don't know. The first item today is the appointment of a Planning Commission member. At their January meeting, the Planning Commission made a recommendation to the Board of Commissioners to appoint Mr. Brad Eldred to the Planning Commission. The board was specifically looking to fill the position from an incorporated city, not currently represented as stated in the Planning Commission bylaws. Mr. Eldred resides in the city of Holly, and he serves on their city council. I request that the board makes a motion to appoint Mr. Brad Eldred to the Planning Commission for a 3-year term.
Thank you very much.
So move.
A motion by Commissioner Campbell to approve the request.
Second.
And a second by Commissioner Gross. I think we now have one more incorporated city from Barnesville that we're looking for applications. So we're looking for that. So make sure if you know someone to filter them over towards the website to apply. Any other, and that's the only opening, correct?
Yes.
Yes, the only other one. Any other comments from the board? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. And then our comprehensive plan schedule, Erica.
Yeah, so we just had an update on the comprehensive plan schedule. At their January meeting, the Planning Commission deliberated and set the schedule for the completion of the 2045 Clay County Comprehensive Plan and Transportation Plan. There will be a community engagement event on Tuesday, February 22nd from 6 to 8 p.m. The Planning Commission plans to make their recommendation to the County Board during their March 15th meeting. This schedule allows adequate time for the townships to review and discuss, as it was mentioned during their Planning Commission meeting, that most townships typically do not meet in January. This also gives the Clay County cities, stakeholders, and the public time for review and input. Additionally, the decision to hold the Clay County, the community engagement event on February 22nd was made in consultation with the Clay County Public Health due to current levels of COVID-19 community spread. The plan is currently to have the community engagement event be both online and in person. And at that time, the County Board of Commissioners will then have the opportunity to hold their public hearing and formally adopt the plan after the recommendation is made by the Planning Commission in March.
Great. Commissioner Campbell.
Yeah, thank you. I just want to point out at our last Solid Waste Advisory Committee meeting, there was one of our members who had requested a presentation regarding this again, probably that dealt with the areas that deal with solid waste. I know it had been on a previous schedule, and I believe that meeting had been canceled or postponed or something. But seeing as how we've had that request, I'm wondering if it'd be possible for somebody to give that presentation at the February Solid Waste Advisory meeting?
We will, Steve, if you can work with Erica and probably Adam to arrange something like that, that's doable.
I know the request was made by one of the members happens to be on the Morehead City Council. And I know that she had requested that a presentation be given there for opportunities for input. So
Okay.
I know we're getting late, but
Yep.
Thank you.
Great, thank you. Steve, can you make sure that both dates, if the board approves them, be added to our calendar?
I will do that, Madam Chair.
Board, yes, Commissioner Kaylee.
The location for the in-person community engagement event on the 22nd, is that here in the courthouse?
Yep, in this room.
This room.
Yeah.
Board wishes.
Move approval?
Motion by Commissioner Kaylee to approve the dates.
Second.
A second by Commissioner Ebbinger. Further discussion. Thank you for adding a Teams option as well to this. I think it's important. Any other discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. Good work. Thank you. Item 8 is a request approval of the calculation of revenue loss as defined by the American Rescue Funds Act. Stephen.
Good morning, Madam Chair, Commissioners. As you mentioned, we're here this morning for a discussion and hopefully some direction on the calculation of loss for the coronavirus state and local fiscal recovery funds. As you're certainly well aware, back in May of 2021, the U.S. Treasury provided the interim rule, which provided the guidelines of how what we a lot of times talk about as CARES or ARPA funds. In addition to that, there was about 130 pages of paper, 130 pages of a document. And during that process, they were looking for additional feedback and questions that came with that interim rule. The U.S. Treasury received over 5,000 different clarifying questions or inquiries and tried to work through that. It became pretty evident that they weren't going to have time to do that. And for a short period of time, U.S. Congress got involved in hopes that they would be able to provide some additional flexibility through legislation. Unfortunately, that did not take place, but the U.S. Treasury did take the feedback that they received and on January 7th adopted a final rule. That final rule provided some additional feedback and specific answers to some of the questions that were provided, and that document went from 130 pages to 400 plus pages. The final rule delivers a broader flexibility and also greater simplicity, hopefully, in the program, and shows that they were being responsive to the different questions. In the interim rule, when it comes to revenue loss or replacing revenue loss, there essentially was one option. The U.S. Treasury provided a formula which our auditor would input the financial information, and it would provide whether or not there was a loss or not. That can be done each year, going through this process of the ARPA funding. When the interim option, or excuse me, the final rule came out, they have provided a second option that counties can select, and that's a $10 million, up to $10 million loss allowance that is known as a standard allowance. Counties electing this standard allowance, it is presumed by the U.S. Treasury that $10 million has been lost or will be lost as a result of the pandemic. Counties may allocate up to $10 million of their total recovery funds to spend on the government services. And when we say government services, the U.S. Treasury determines that that's any service that's traditionally provided by county government. So when we look at the replacement requirement, we are, as a county, required to select one of the two options. In looking at the second option, certainly it simplifies the reporting requirements for counties using the standard allowance. In working with Lori over the last few weeks on this report, the reporting requirements are much more tedious than we had with CARES. Each individual funding allotment that you guys approve becomes a project. And that project has to have ongoing updates on that information through the entire process until those funds are completely expended. And so, which is maybe a little bit easier on a one-time payment, but for some of those positions that go on annually over 1 or 2 years, it requires the auditor's office to continue to do that. It's important to understand that if the board were to select the $10 million standard allowance, it doesn't absolve the county of all reporting. There still is requirements that we would have to comply with, but it certainly does simplify that. In talking with Lori, if based on the new reporting guidelines, the auditor's office would very likely be coming back to the CARES, or excuse me, the ARPA fund for additional work. And in total transparency, part of that would also, some of that work would fall back on me, because there's a narrative piece that goes with each project that is different than what it was with CARES. One of the things that U.S. Treasury shared is there's 2,137 counties, or 70% of all counties are eligible to allocate, are eligible to invest their entirety of their allocation into general government services under this standard allowance. We do have to be clear that there are still restrictions that do come with this. The intent of this is of these funds are to get people back on board, address different infrastructure. So they're not looking for the county to put these into rainy day funds to utilize at a later time. They're also not to be utilized for debt services, and also can't be utilized to making pension contributions or pensions whole. As I mentioned, as a tier, we're considered a tier 2 county here in Clay County. That means we have a population of under 2,500, 250,000 people, but we've received more than $10 million. And so Clay County is required to submit a project and expenditure report for the periods of May 3rd of 2021 through December 31st of this last year. And as part of that requirement of project and expenditures report, we are required to provide which direction that this board would like to go. Either one, the $10 million of the standard allowance, or calculating the revenue loss each year. Now, it's important to understand that at the end with the calculation of the revenue loss, if Clay County doesn't show a loss in future years, we would not be eligible to utilize those funds other than specific ways that are identified through the final rule. One of the things I think when it comes to the standard allowance, if the board were to select this, the ARPA community could continue to meet as the same way that we do now. Proposals could still be brought to this board for approval with continued transparency. We can continue to provide the internal tracking and updates that we've been doing. Today you have the most recent update for our spending. And it provides more flexibility for Clay County in what we could utilize those dollars for. There are certainly fewer reporting requirements, that will have both benefits to both staff time and that flexibility. And just for the board's wishes or knowledge, the ARPA committee will be bringing forward that this would be the choice that they would wish to select or bring forward. And with that, I would yield for a further discussion and any questions.
Thank you, Steve. Going back to your presentation, I think it's important that this decision will not change how we internally track and audit those funds. It really is an opportunity for us to identify internal problems that would occur if we would not choose this. I think it certainly would result in increasing staff and new requests that way. It seems to me that this is the best option for us. I don't know if you did note it, that there is an April opt-out date. If in the time between now and then we determine that it is not in Clay County's best interest, we can opt out. However, if we do not act now to opt in, we will not have the opportunity going forward to opt in. Commissioner Campbell.
Madam Chair, just a clarification and transparency here. We learned of the need to opt in just last week, and the deadline to opt in was yesterday. And so through our ARPA committee and through Chair Mojo and myself, we did give the approval to opt in yesterday to meet the deadline, which was yesterday. With the idea in mind that if later we disagree with that or want to change that, we have until April, I believe it's April or May, to opt out. So just so you're aware, from a transparency, that decision had to be made before this morning. So we made that, but we did request that we get confirmation from this full board that we did the right thing. So,
Commissioner Ebinger.
Yeah, I appreciate that you two showed the initiative to keep this from getting by us without the presumption that that's a final decision. I think it was a good decision. I'm looking at the transparency that comes with this. We're still accountable. We still have to explain where the money goes. And it doesn't turn this into a bureaucratic nightmare for our staff. So I'm very supportive of this, and I appreciate the initiative of the chair and Commissioner Campbell in making sure this was still an available option.
Commissioner Kali.
Thank you. I too support this, and thank you for taking that initiative as well. I think the amount of staff time and potentially a new hire needed to deal with the paperwork just for managing this program would cost the county a lot of money. So by opting in, we're actually able to give more of this money back to our community instead of just paying for staff time. So this is a win for the county. Thank you.
Commissioner Campbell.
And a follow-up to the staffing issue that you just talked about too, and one thing that Lori talked about too, it wouldn't be really her staff, it would be Steve's staff that would have to be dealing with this, and our administration definitely has enough on their plate already. So I agree that this is a really good way to avoid additional staff time as well.
Commissioner Gross?
I think the move that you guys did yesterday was good, and I make a motion to approve it.
Thank you. A motion by Commissioner Gross to
Second.
the request, a second by Commissioner Ebinger. Further discussion. All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. Thank you, Steve.
Thank you, Board.
Just stay up for the next two. Item 9 is a request to approve the creation of a Clay County Board of Commissioners work group. I did request that we put this up for discussion today. As someone who's served on this board for a term and a half, the amount of committees that we have added to commissioner portfolios has certainly grown substantially, and I think it's because there's a substantial need for commissioner involvement in those committees. In order to maintain the most transparency as possible, oftentimes it's really difficult to have substantive discussions about issues that may overlap with different committees. And I've been on this board when there were important discussions or decisions that needed to be had, and felt that maybe that was happening at a committee level, and the whole board didn't have the full grasp and understanding. Certainly understood that the commissioners on those boards were doing the best possible for the county, but felt that it was difficult to really be part of that decision process. I know that certainly in the last couple of weeks, there's been discussion about our detox grant approval and moving forward with that in terms of dealing with the detox committee and the substance abuse committee and the finance committee and the building committee and the long range committee, and those are important committees, but because there's so much overlap, it stifles the timeline in which we can approve issues. And I think that, as many other boards do, and county boards and municipal boards and school boards, to have the ability and freedom to have a work group that would meet as needed, that would not take away from the county board schedule, but to address some of these issues that do come up, to allow the commission as a whole to have the best understanding as possible, I think would be important. It's also to note that the board would conduct work group sessions as needed. We'd receive information from staff or outside agencies regarding current and upcoming issues or projects in advance of any request for formal action. The county board would not take any formal action at these work groups. But I certainly would put it to the board for discussion, but I think it would really save time, it would save staff hours, but it would also help the whole board understand some issues that we need to address. Commissioner Gross.
I think I agree with you on that, and some of these committees, like you brought up, the detoxification, there's quite a few committees involved in that. And then you have a 1 hour, 2 hour meeting, and then you come to the report at the board meeting. You get about 1 to 3 minutes of a report of a 2 hour meeting. And I think it's important that we get more information out concerning what's happening in some of our projects, instead of just a short notice and all of a sudden it's on the agenda here, you want to approve $5 million or whatever, so I think it's an important thing, we should do that.
Thank you, Commissioner Gross. Commissioner Ebinger.
In addition to that, one of the things that's always impressed me about the county commission is that they bring people in with a level of expertise. And in the bigger projects, a lot of local entities have a committee of the whole as a recurring schedule. That's not necessary here, but we do have some issues that require understanding of human services, accounting, criminal justice, all of these things. With it, we do have people with expertise on this board. So I think this is a good proposal. it's a responsible use of our time, and it's, again, we have a staff that is not thin, but they're carrying as much as they can carry. And if we can do something to make our needs more efficient for them, I think that's productive. So this is a good idea.
Thank you. Commissioner Campbell.
Yeah, I certainly agree on areas of, especially when it comes to capital investment and long-term planning in those areas. I would hope that we don't get this confused with the normal weekly operations of a county board and the responsibilities that we do in open public, and which this other one would also be.
And advertised.
But I do believe that that I agree with this process in a limited scope in terms of not your typical government function, but when we have to take what might be each of us that might be on a different component of a committee that deals with an overall same goal, such as a potential detox facility. Thank you. And the same might be down the road as we move forward with discussions regarding dispatch, future needs of dispatch. Those things are something that can require a major investment. And those things should be discussed. And as long as we're talking about coming together for those types of things, I fully support it.
Thank you. Commissioner Kaylee?
I think one of the beautiful things about the current makeup of the board right now is we all have very different backgrounds and we come with different life experiences and expertise. And I think this will really be a benefit to the county in expediting some of these big projects and also making sure that citizens from all these different areas are heard and represented. And so yes, I fully support this as well.
Thank you. And I think as note, it's important to state that as we try out this model, it's not going to be a standing every month, fifth week of the month or fourth week of the month. It will certainly happen as we develop the timeline for what we need to address. My hope is that we will have a work group sometime, either the very end of this month or beginning of March, because there are some important topics that we need to discuss. I also want to state that I think it's really great how government is set up to be as transparent as possible. And it is important that decisions are made in the open. And this request really comes from me identifying the difficulty with so many different timelines and committees, the difficulty in making sure we're honoring the transparency piece. Not that there's been issues in the past, but going forward, I really do feel like there are conversations and decisions that should happen in an open forum. This will be an advertised work group, an open to the public work group. And, but I agree with Commissioner Campbell, this will not change the importance of committee reports at the end of our commission meetings. It will not take place in bumping our commission meeting schedules. We'll certainly need to look at the board's availability, if it makes sense to have a Tuesday afternoon work group after board meetings. I'm not sure what that looks like, but we'll work towards that and work towards what agendas in the future will look like.
So with this request, what is the process for determining when the work group would be held? And who establishes an agenda for that work group?
Well, Madam Chair, Commissioner Campbell, I anticipate that I would be responsible for completing the agenda. And again, the agendas that are provided would be, that is the sole focus of meeting. There couldn't be any other discussions that came about during that time. I would anticipate that at the direction of the board chair, through feedback from yourselves, it would have the ability to recommend that we would be looking to have, or when we would be having that work group. And so again, to to the chair's point is, again, these are all subject to the open meeting laws, and Colleen or Rita, in this case, would make sure that those were posted as part of your annual meetings.
And similar, I believe, to how I went about requesting this beyond the board agenda. If you're identifying in your committees areas where there is overlap, and because 2 of your committee members are on that, and it's something that really is a pressing issue that needs to happen, you can make that request to either myself as the chair or Steve, and Steve and I will work in collaboration to make sure we're creating an agenda. Commissioner Ebinger.
I believe the request is to approve the creation of the Clay County Board of Commissioners Workgroup, and I'd like to make that motion.
We have a motion by Commissioner Ebinger to create that, a second by Commissioner Kaylee. I think it's probably appropriate that my request did not include this as a per diem committee. I felt like it was an extension of our duties on the Clay County Board. Okay, does that?
I would include that in my motion.
Thank you. In a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Granted. Thank you for your support. Item 10, a request to utilize ARPA funding for disposable masks. If you recall, last week in my committee reports, I did touch on this. Our emergency manager, Gabe, had identified the lack of masks that we had available and did need to make a purchase quickly. This board has given authority to Commissioner Campbell and I to approve small requests in advance if the time is of the essence. And so this is one of those items where we will need to go back and do a formal approval.
I have a question.
Commissioner Gross.
I hear, there's a lot of places coming out with free masks. Why are we paying $1,400 for masks?
Commissioner Gross, if you do recall, this morning, we did hear from Public Health that we were able to get 10,000 of those free masks. This order had to happen in early January before we were aware of the free masks. So it's unfortunately just a timing issue, but as this board had implemented the mask requirement in county-owned buildings, these are the masks that are available for folks that may not have them at access, and certainly for our confinement.
And Madam Chair, Commissioner Gross, as was mentioned earlier by Becky, the allotment of those 10,000 masks first are specifically to go to certain populations, and not that our staff couldn't utilize those. But one of the things that Kathy's talked also in detail, the challenging part about the N95 masks is they're tough to wear throughout the entire day. Short periods of time they're easier, or I guess more capable of wearing. But so from our, and they're also more expensive. So from someone's coming into our DMV or into our courthouse, those N95 masks are quite a resource that we wouldn't just want to hand out to anyone that end up in our parking lot or trash.
Any other board questions? Commissioner Campbell.
Keep in mind that these were to cover disposable masks like you talk about, and when our board decided to go back into requiring masks within our public facilities, it was important that we have available masks for people who, when they enter, and I'm talking about our citizens who are not employees, they might come here without a mask, and to have those disposable ones, it's much cheaper than handing out an N95 mask for the purpose of coming in for a short visit. So. I would move approval of the ARPA funds used to cover the cost of disposable masks.
Second.
We have a motion by Commissioner Campbell to approve the request, a second by Commissioner Ebinger. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. Thank you.
Thank you.
And we are back on time. Our item number 11 is our highway department requests. Good morning.
Morning. Yeah, we're right to the minute here, aren't we?
Yep.
We have 3 items on our agenda this morning. First item, I'll have Justin give a little brief information on there. It's with regard to a final voucher from last year's construction.
Yeah, so the voucher we're bringing forward today is for the bridge replacement on County Road 68. It's just southeast of Sabin. The general contractor was Garrett Hansen Contracting out of Black Duck. There was quite a bit of grading work on this project and a bridge replacement, and we feel it turned out really, really well. It was done ahead of schedule and right around harvest time. The initial bid for the project was $681,350.50. And the final amount to be approved is $640,908.75. And the project number for this is SAP 14598-072.
Great, thank you. Not often do we get a final amount that's less than the bid.
Move approval.
Motion by Commissioner Campbell to approve.
Second.
And a second by Commissioner Gross. Further discussion. All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. Item 2 would be looking for approval to purchase 2 walk and roll packers. Attachment L.
Right, we've got these walk and roll packers on each one of our motor graders, and we're following our internal service schedule. We'd like to replace 2 of them that are ready to go. We continue to purchase these from a company in Montana. The last time we purchased them was 3 years ago in 2019. We bought 2 then, and we'd like to purchase 2 now. 16 to 20 week lead time on these, so not as bad as some things. On a side note, we're looking at purchasing some radios, and they're 6 to 9 months out for like a Armor radio, so it's still kind of ridiculous how long things are out, but our maintenance staff would really appreciate if we could move forward on replacing a couple of these. We are looking at trading 2 in. This is the first time we've ever, I don't know, for those that may not remember, I think we initially bought 1 or 2 of these things maybe 12 years ago, and then we thought the idea was maybe we'd trade them, you know, like maybe out in the field they could back up and switch them, and then we bought a couple more, and then we bought hitches for all the machines, and it took quite a few iterations, but we do have them now on every one of the motor graders, but it took a while because they're kind of expensive, but so anyway, this is the first time we're looking at doing a trade-in, and the shop staff says they gave us a really good trade number. I think we have 4550 on one and 4750 on another, so we got a decent trade as well. There is an extra of about $12,000 in the internal service fund, so it is fully funded there as well.
I will note the number that they gave you for the trade-ins is about $2,000 higher than most places are advertising used, so that is a good deal.
I move for approval.
Motion by Commissioner Ebinger to approve the request.
Second.
And a second by Commissioner Gross. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. Item C would be an approval of the grant agreement and resolution for 2022-7.
This is for the County Road 1 grading project that we awarded to Dennis Drews. I'll Justin give a little information on that, and I think there's a 2-part action on this one, is that right?
Yep. So we opened bids about 3 weeks ago for this project, and we felt like bids came in really well. And part of bridge bond funds were part of this project, so this is just what MnDOT does require. It's a grant agreement and resolution. The total amount of bridge bond funds that we received was $152,080. And MnDOT does require, like I said, the grant agreement and resolution for the use of bridge bond funds.
So the total cost of the, is it a double cell?
Yep.
A double cell box culvert is, you'd actually double that grant agreement. So if it's on a state aid highway, they fund them 50-50. So we do have to come up with or utilize $152,080 of county state aid funds, and then we get the other half paid for by bridge bonding. The nice thing is, according to our 5-year plan numbers that we budgeted for, we are underneath that estimate by $160,000. So the net between the two are still under on our 5-year plan numbers by $132,000. So it's something else were to go a little bit higher, we're on the right side of the cushion anyway.
Okay, questions? If not, we do have resolution 2022-7 before the board.
Move to approve.
We have a motion by Commissioner Gross to approve,
Second.
a second by Commissioner Ebinger. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. And thank you. I did want to just comment that I did get a letter from David Peterson from Grand Church in regards to the signage, and forward that on to Commissioner Campbell. And I know you'll internally take care of that, but wanted to publicly acknowledge that piece.
Do we need a separate motion on the grant agreement, do you think? Or for the,
Typically, we do, yes. We get one motion for the grant agreement and one for the resolution.
Okay. So grant agreement 103-5186.
Move approval.
Motion by Commissioner Campbell to approve,
Second.
and a second by Commissioner Kaylee. Any further discussion? All those in favor of the motion signify by saying aye.
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 Opposed, same sign. Carried.
so Justin did a little looking with regard to that signage for the church there, and he found a sign that looks like real similar to what they were talking about.
Perfect.
We'll go out and take a look and see where it can be located, and we'll get that ordered.
I think that the request falls in line. I know that's a concern area.
Absolutely.
Thank you.
Yep, thank you.
Okay. Committee reports. I know that you all were extremely busy last week, so feel free to abbreviate if you need to. Commissioner Kaylee.
You like to start with me, don't you? Last week on Wednesday, Steve presented an update at the Moorhead Business Association meeting on just what the county's been up to, some highlights, and then all of our commissioners were there as well at that meeting. It was really great to see, and I know that we all kind of hung around and had a lot of conversations afterwards. I know I was involved in a bunch of conversations about housing in the county. So thank you to Moorhead Business Association for reaching out to the county, inviting us to do that, and thank you to Steve for representing us well and taking a lot of questions, and Jenny answered a whole bunch of questions as well about COVID and the letter that we had sent to the state. Thank you all for that. On the 27th, I attended the CAP-LP board meeting. We had some fiduciary training put on by the finance director, Brenda. This is a really great board to attend because there's always an investment in training board members in their responsibilities at these meetings. So we looked at some fiduciary responsibility pieces for that. We did a lot of just general business items like approving the IRS mileage reimbursement rate, and we also approved the sale of some agency vehicles. And then I had horrible sound trouble and had to leave for another appointment. So I will let Jenny report on the rest of that meeting as she was also, sorry, Chair Mojo, on the rest of that meeting as she was also in attendance. And that concludes my reports. Thank you.
Thank you, Commissioner Kaylee. Commissioner Gross.
I was at the same update that Steve gave at the Legion, and from there I went over to the LEC Center where they promoted 2 officers. They had a ceremony there for promotion of 2 officers. Those are my 2 things I attended.
Thank you, Commissioner Gross. And I believe Commissioner Kaylee was at the promotion as well.
Yeah, that was great. Wonderful turnout from both the county and outside of our county for those folks.
Great. Commissioner Campbell.
All right, I have down here on the 25th that we had a PIC meeting, and I don't have.
I have the notes, I can read.
Okay, I'll let you report. I do, for some reason, I don't have that.
In your
with
stack.
my stack of stuff last week, yeah. Start off with Wednesday morning, we had a Prairie Lake Solid Waste meeting, and I have a few things to report on there. It was quite a good meeting. And I got the honor of being elected chair of that group for this next year, but some important things of note there was our financial position is really good. In 2016, we had to have a cash call because we were short of cash, if you all recall, and we ended the year 2021 with $1,666,000 in the bank, which is quite a turnaround from being a negative.
Commissioner Campbell, that's why they elected you chair again.
Okay, yeah, right, okay. Yeah, and a couple of other items of note is we had anticipated 54,000 tons being processed in that facility, and that's how we based our budget on. We did have 53,122, so we came closer to our number of anticipated tons for the first time. I mean, this is the closest we've been. And the tons per day that were processed were 169.7 tons per day compared to 158 the prior year. So of all of the things that we did there, that plant is operating extremely well and efficient, much better than it had in the past. The natural gas costs went up by about $250,000, but at the same point in time, with the efficiency and the steam generation, that cost was offset with additional steam sales, so it's really good. In Clay County, in 2017, we were under delivering based on our 8,400 tons by about 1,942. Happy to report in 2021 we delivered our full amount, so that was really good. I could say more on that, but I won't at this point. Time that same day, then in the afternoon, we had a public outreach meeting. We had a really good presentation or video prepared on the whole hydraulics of the project and how all that works, and something that will hopefully be used to help answer questions of landowners as we move forward with flowage easement discussions and all of those types of things. And I asked about some hydraulic models to help maybe answer some questions about drainage, even if you're outside of the staging and storage area. On the Minnesota side, for any landowners who are south that might be wondering during an event where their water is going to go and how it's still going to flow. So and the same thing up around the Georgetown area where the diversion would drain into up in that area, to make sure that those people are comfortable with the hydraulics. We then had our land management meeting, and we had quite a bit of discussion about flowage easements. This is the same update that our MCCH JPA board got. And then we talked about access to cemeteries and how those cemeteries are going to be dealt with. And I think most of them were looking at probably having ring dikes around those. Something of note, we've acquired more than 750 parcels for that project. So it's I remember back when we got our first one, how excited we were, and now we're up to 750. And because I was at that meeting, I got voted in as vice chair of that land management committee.
You like it?
Yeah, right. And then we also, so then the next day, or at noon that day, I also attended the MBA noon meeting, and thank you to Steve for your presentation, and thank you to Ward Business Association for allowing us to give some county updates and for being there to answer any questions they may have. Thursday morning, we had a Solid Waste Advisory Committee meeting. That would have been on the 27th. We had reports on the recycling activities from Shannon. We had a landfill update from Brett. And then an update from Kirk on several things, including a brief discussion on the construction update. And we had a discussion regarding SCORE funding. That same day on the 27th, we had our MCC JPA board meeting. And we had a property acquisition status report. We approved a U.S. Army Corps of Engineers questionnaire that's going out, a flowage easement update, and we did have a closed session dealing with the landowner. And within that closed session, I think we came up with a very good opportunity to maybe resolve something that's before the courts right now on a particular parcel or parcels of land in Clay County. Not yet heard on that proposal, but hopefully that worked out. Then later that day, we had the Diversion Authority Board meeting, and the only thing I remember from that meeting is I got elected vice chair of that group. Yeah, thank you, yeah. So, well, we did discuss we did have quite a few approved MOUs, memorandum of understandings, and I won't go into any more detail there. Friday morning, we had a Red River Regional Dispatch Center meeting going over this proposed draft. I think we're making an awful lot of ground compared to the original draft that was done. That was probably much more overreaching than it needed to be. And I'll let Dave, Commissioner Ebinger, get into. He's got more notes on that than me, so I'll let him give that report. And then yesterday we did hold our ARPA committee meeting, and we did have a presentation from Halstead Utilities regarding a rural water plan that might could potentially involve some residents in northern Clay County. And then an update from Mark Sloan on some website issues. And we got a brief update on the Diversity and Ethnic Community Coordinator. And I think maybe we'll hear some more from that by Steve today. And that concludes my report.
All right. Thank you, Commissioner Campbell. Commissioner Ebinger.
Thank you. This last week, both on Wednesday, the 26th, and Monday, the 31st, I virtually attended 2 sessions of the University of Minnesota Extension Service training for leading economic transformation. Chair Mojo is also on that virtual training. It's been interesting, and we have 2 more sessions to go, and it's given me some information I think is going to be useful in my role as a commissioner. Wednesday, the 26th, I also attended the Moorhead Business Association meeting with all the commissioners and County Administrator Larson, who did a great presentation, represented the county well, and it was always a pleasure to go to MBA. It's a good bunch of people. Unfortunately, I couldn't make the sheriff's promotional ceremony because of the Moorhead Fargo Diversion Authority meetings we had later that day. I attended the Public Outreach Committee meeting. Commissioner Campbell covered that pretty well. Just one thing that in Executive Director Paulson's presentation, they are working with the new PPP partner to get good communications out with the lands program, community relations, emergency management and crisis events, and public affairs and industry. they've got some focus on this, and there'll be some progress as they move along. Also, the video is very impressive. I think it's a great step towards getting the public informed on what's going on. Later that day, I attended the Finance Committee meeting. We had nominations and elections of Mayor Bernie Dardis as the chair and Commissioner Rick Steen from Cass County as the vice chair. Had a discussion on Bank of North Dakota, working with them on getting the bonding dollars out to meet some of the really high cost invoices. Executive Director Paulson gave a revenue status report, the annual revenue status report. And Ide Bailey has been selected to conduct this year's audit, and they'll be taking over the financial reports from the city of Fargo. The following day, I attended the Board of Authority for the Diversion Authority, and had the pleasure of nominating Commissioner Campbell for vice chair. He was elected unanimously. The rest of this has been covered pretty well in his report. We did have updates on the Public Outreach Committee, which I've already covered in that committee's meeting, and an update on the finance that I've already covered there. The following day, the Red River Regional Dispatch Center Draft Joint Powers Agreement. We had a meeting. Both sheriffs, police chiefs from all the communities, fire chief from Fargo, Mayor Dardis, the city manager and assistant city manager from Moorhead. Just a really good turnout of people who wanted to sit down with what's a pretty extensive joint power agreement draft. The two attorneys that have worked on it were there, and we spent a couple hours and got about halfway through it with the understanding that we needed some major revisions done. The lawyers understood where we wanted to go. They're going to work on the draft. It's going to be, I think, more a matter of cutting it back as adding anything. And we'll meet again here in a couple of weeks, but good progress on that. This is going to be something we've got to live with for a long time. We want to do it right. And then last night, I was board representative on the Lake Agassiz Regional Library Board for negotiations with for a union contract with ASME employees. We had a meeting, it went well, and there will be, I think there's been some good progress on that. And that completes my report.
Thank you, Commissioner Ebinger. Commissioner Campbell?
Yeah, Madam Chair, if I can just go back to my report on Prairie Lakes for 1 minute, Prairie Lakes Municipal Solid Waste Authority. After that meeting that day, Kirk had arranged for me to do to meet with Brian, who's the superintendent there, and to look at their transportation trailers that are used for hauling ash to the landfill. And you recall here quite some time ago, there was a recommendation on certain trailer equipment to buy, and I had suggested holding off, or we just buy one and then modify the other one. And part of that was this process that we're researching. And currently, municipal or Prairie Lakes has 6 of those ash trailers that would go to the landfill. And they were looking at what numbers they would have to increase to help provide that deal, where 2 of them would always be at the new facility and then transferred to the landfill, as opposed to going all the way to Purim. And Brian indicated that he felt that Prairie Lakes would be willing to invest into those additional trailers. So just as we move forward and we're looking at all these things, I mentioned that I was not an advocate for that third new trailer at $100,000. I'm not suggesting that we might not still need that, but we're still reviewing that process, and I just wanted to make sure the board is well aware that we're looking to come up with a solution for driving with empty trailers. Thank you.
Questions? Thank you, Commissioner Campbell. Last week, I attended a PIC committee meeting right after the Regular board, we did address the wage increase for our interim jail administrators, so thank you for this board's support on that. Commissioner Campbell was present there. After that, we did have a meeting to discuss the Resource Recovery DRAP Cooperative Service Agreement. Commissioner Campbell was also present at that. I think there's really some headway that's happened with that. I think that proposal went to the city of Moorhead at the end of last year, so hopeful that we can come to an agreement on that, but I think we did ask for a follow-up discussion with city of Moorhead representatives as well, so Steve and Kirk will work on that one. Tuesday evening, I had a virtual meeting with Representative Keeler, as I discussed with the governor's office and the Minnesota Department of Health. I'm hopeful that we can continue to make adjustments to the vault testing site that will serve the community as best possible. So hopeful for that. That day, I also did have lunch with Representative Michelle Fischbach to discuss items of need for Clay County. The next day, I, as part of her Northern Ag Advisory Group, we did have a long discussion about issues that affect ag in Clay County. Ranking member G.T. Thompson was also present on that. There was some issues from growers' points of view, certainly as they address the farm bill coming up, but talked about supply issues and transportation infrastructure needs that are really important to rural Minnesota and Clay County. That afternoon, I also attended the Moorhead Business Association meeting. Steve, thanks so much for the work that you did to prepare that. That presentation certainly was great discussion with Moorhead Business Association members and community members about Clay County and the programs that we work with every day. I also attended the SWAC committee meeting. That committee report was covered well by Commissioner Campbell. I, that afternoon, had a discussion with Holy Cross Township members in concern with some road needs in the staging area of the Diversion Authority. It's my understanding that they've also had meetings with our county engineer on those issues, and they did request their feedback be heard in regards to township land retaining of rights going forward. Certainly we'll talk about those later. That afternoon, I attended the MCC JPA meeting. We did have a good property acquisition report. Did we have land management this week? I attended the land management committee meeting that Commissioner Campbell reported on, sorry. But I really do feel like that closed session that we had hopefully will come show the flexibility of the joint powers in dealing with our landowners and producers, and certainly we'll have to continue to evaluate our policy in terms of excess land, but I think we're on the right track. I also attended the CAP LP meeting. Certainly felt like Commissioner Kaylee addressed what we covered at that committee meeting quite well. They certainly are feeling the shortage of employees and dealing with open staffing patterns and dealing with that. Their needs are great as they continue to meet the needs of the community. As Commissioner Ebinger stated, I'm also part of that leading economic transformation cohort that the extension is offering, and feel like there's a abundance of information on how different agencies have really pivoted during COVID, and how we're continuing to evaluate programming and needs areas, and how we advocate for the programs that we are providing. And then yesterday, attended the ARPA committee meeting. Commissioner Campbell covered quite well. Not sure if I missed anything. It was a busy week. Steve.
Thank you, Madam Chair. Last Tuesday, I attended the PIC meeting that has been addressed. also the Resource Recovery Cooperative Service Agreement discussion. That afternoon, I had a meeting with David Overbo on a series of highway issues. On Wednesday morning, we had county management, COVID update. We discussed the ARPA and also a number of HR issues and pertaining to COVID. Again, just want to continue to thank our management group for that commitment. We meet every other week, and their leadership really has been imperative to a lot of the successes that we've had. And so their continued work doesn't go unnoticed, and I certainly appreciate their work. On the 26th, I had the opportunity to talk to the MBA luncheon. I want to thank them for that opportunity. They did ask after we were done if this would be something that they'd really like to see the county there on an annual basis, just to kind of fit in with all of their other presentations. And so I think we're on their schedule. And so that afternoon, I did attend a promotional ceremony. Sergeant Kyle Diekman was put in a leadership position within the patrol division, and Nicole Reno is in support services for warrants, transports, civil, and court security. So well deserved there. And again, to Commissioner Kaylee's comments, just a wonderful to see what support our law enforcement community has for each other and those individuals' promotion. I think it says a great deal about who they are as people and as officers. That afternoon, I met with Lori. Last week, we met a couple different times on the ARPA project and expense reporting. That was due yesterday. I want to thank Lori for all her work on that as they're with the final interim, the final Treasury guidance. There were some changes, again, as we've talked about, that happened here within the last week or so. On the 27th, I participated virtually with the SWAC. That's been addressed in detail. I also, that morning, participated in a meeting with representatives from the Clay and Cass County Sheriff's Department and also the County Administrator Robert Wilson, Birch Burdick, on just some discussions with Water Value Rescue and looking to clarify some issues as far as services outside of our region. So we'll have some additional meetings there. I met that afternoon. I met with Robert Wilson on the upcoming triple RDC meeting that we had on this past Friday, and also further discussion on the Water Value Rescue. One of the things that, in regards to the triple RDC, a number of weeks ago, our committee assignments, we were going to meet with the architect firm, SEH, who's in charge of that. We're going to be having that meeting ended up being canceled, but they're looking to reschedule that. But also, commissioners, they're also looking to have a subcommittee for SEH is looking to have a subcommittee that they would like to have only 1 or 2 representatives from each entity. And so that's one thing I'll probably touch base with you about here in the future. MCC JPA, again, has been discussed. We had talked to the property acquisitions, flowage easement update. There is going to be a public meeting in March, and we'll have some additional information that'll be coming about that in regards to the flowage easements to answer questions from our citizens. On 28th, I met with Joe Olson in regards to upcoming building committee. And again, just want to note what a nice job Joe does. If you walk around our campus right now, there are multiple things that are happening at the same time. And Joe's just done a remarkable job of maintaining all those different projects. And so I thank him there. 28th, we participated in the triple RDC JPA with representatives from Cass, West Fargo, Fargo, and Moorhead. That's been addressed. On the 31st, participated in an ARPA meeting. We had a couple different presentations. We looked at updating information on our website in regards to ARPA, and then our discussion with calculated the revenue loss. I also met yesterday with Roy Schmitz, IT director. Generally in the spring, we start having budget updates, or department updates with the budget updates more in the summer. And so I think next week we're going to we'll start with Rory. He's going to lead us off with our department updates. I did provide the most recent board our information from ARPA as far as funding goes. If you have any questions, please let me know. As you guys are aware, yesterday the Minnesota legislative session kicked off. And so it'll be an interesting year to see with bonding and also a $7.7 billion surplus, what things will get taken place. As Commissioner Campbell noted, we've had some movement with our diversity and ethnic community coordinators, and I hope to have a full report for you next week. And lastly, again, Colleen is out all this week, and we thank Rita for stepping in at board today and also establishing our board agenda for next week. And that concludes my report.
Any other board information? If not, we are adjourned. Thank you.